Hello, and thank you for joining us today for this webinar that will introduce you to the evidence-based fall prevention programs that are supported through the Healthy Aging NC Resource Center. I'm Ayden Jones, the Fall Prevention Program Manager here, and I'm going to spend the next few minutes telling you about the work that we do and why it matters. Here at the North Carolina Center for Health and Wellness, we develop equitable opportunities that lead to healthy North Carolina communities. Some of the greatest gaps in healthcare and equitable health outcomes focus on older adults and older adults with disabilities. We address these issues through a focus on fall prevention and chronic disease self-management programs. We work to impact policy, build capacity, and ignite initiatives by working through a web of cross-sector relationships organized around building healthier places throughout the state. Who am I and why do I care about fall prevention? I've been studying healthy aging for many years and trying to determine how the term healthy aging can be defined and what does it mean to be healthful as we age. I've determined that fall prevention is a key to quality of life in elder years, and incorporating fall prevention strategies is essential to preserve independence and well-being across the lifespan. In addition to fulfilling responsibilities for the fall prevention work here at the Center for Health and Wellness, I also chair the WNC Fall Prevention Coalition and am an active partner of the advisory team for the state coalition. I care deeply about this work as I have experienced firsthand the devastation that can occur within a family when an elder experiences a fall or multiple falls, and firmly believe that all older adults should live with as much dignity as possible for as long as is possible and comfortable. Approximately 60 to 70% of falls can be prevented. Fall-related injury and death do not have to be accepted as a normal part of aging, and we can support our elders by implementing targeted strategies. Here in North Carolina, falls are the third leading cause of unintentional injury and the #1 cause of injury death for those 65 and older. The death rate has increased nearly 66% from 2000 to 2011. 2 people die every day in North Carolina, and countless others are going to the ER for fall-related injuries such as a fractured wrist or a bump on the head or a smaller fall that may not be that devastating event that can occur. By 2030, it's projected that 73 of our 100 counties will have more older adults than people who are 0 to 17. All of this injury and ER utilization and hospitalization is very expensive in terms of quality of life and in terms of healthcare dollars. It leads to a diminished quality of life for our elders. We're working to build statewide coordinated efforts to address this issue. These are some of the partners that we work with: regional and state fall prevention coalition, the Division of Public Health, their Injury and Violence Prevention branch in particular is a strong partner of ours. The Division of Aging and Adult Services is a strong partner of ours as well. And the Offices on Disability Minority Health, several UNC system schools and other universities, the area agencies on aging, the YMCAs, senior centers, and others. What we're working to provide is a single point of entry for participants to fall prevention programming. This is a centralized, statewide coordinated effort, and we are also providing data collection for 2 of the 4 fall prevention programs that we support statewide. On our healthyagingnc.com website, you will also find a variety of healthy aging current events and articles and some resources for fall prevention. One of those resources is a fall prevention Continuum of Care toolkit so that people understand and can see on paper what is our vision for how people move from one program to another, so that we're really building a safety net where there's always something available for them and they do not have to be without support. We also have a fall prevention packet of information for caregivers and families. If you can't immediately get someone into an evidence-based program, you can provide them with that information to implement some fall prevention strategies into their life. The programs that we support at this time are the A Matter of Balance program, which addresses concerns about falling. We know that there's a strong correlation that if someone's afraid of falling, they tend to become more isolated, which means they're less active, and as they become less active, they lose strength in their legs and the rest of their bodies, so that when they do have to rise and get up to go to the bathroom, then those fall injuries are occurring. And the number one place in the home for a fall injury is the bathroom. So A Matter of Balance is a great program that addresses concerns about falling, teaches people how to make their home safer, and introduces some manageable exercise for people who may not be familiar with physical activity. We also support the Tai Chi for Arthritis program, which we find there's a benefit for fall prevention after one reaches 16 hours of Tai Chi practice. That movement is shifting weight from one hemisphere of the body and brain to another, and it's very effective for building strength, and it is very gentle on someone who may have some joint issues. The Otago exercise program is also a program we support. It's delivered by a physical therapist, and what we like to do with the physical therapists that are trained in Otago is offer materials to them to explain the community-based programs and how they can move people from the PT services where they're implementing Otago exercises into one of the community-based programs to be a further support. We are also supporting the YMCA Moving for Better Balance program, which is a Tai Chi-based program that offers fall prevention strategies, and that is through the YMCAs with YMCA-trained instructors. We offer data collection for the A Matter of Balance and the Tai Chi for Arthritis program statewide. So if you're offering either of those programs, please send us your information at the close of those classes. The measurable outcomes that we expect to experience are increased public stakeholder awareness of programs and services, increased capacity to provide these programs and services to the community, increased healthcare provider knowledge of falls and fall risks, and we're really working quite hard to develop clinical community partnerships to establish referral systems so that all of the people within clinical environments are aware of these programs as a strategy for fall prevention, and they know that they can refer people into the community programs, and they're aware of what's going on in their communities so that there's a really good linkage and communication there. We expect that older adults and older adults with disabilities through these programs will experience greater self-efficacy. That's documented and shown that these programs are helping people to manage their concerns and their physical limitations more effectively. Other outcomes and benefits, we see people integrating the programs along a continuum of care so that there's always a program for someone to enter into and to be supported. We also want to see integration of program cost data and decision making. So as we're collecting the information about these programs and what works in communities, we're able to inform capacity building for other areas or refinement of the processes already in place. We expect increased participation, awareness, and health of the participants who go through these programs, and in general for communities to become more aware and to have more ownership of fall prevention strategies. And again, we're also trying to embed these referral systems so that everyone's aware of what's going on. There's connectivity across the state, and that the fall prevention is recognized, and not only that, but that the strategies for fall prevention are implemented. Ultimately, this all makes an impact for the elders in North Carolina. We want to really see a paradigm shift that falls are preventable and not a normal part of aging. We want to see incorporation of programs into organizational, healthcare, long-term services and support systems, and community planning and policy. And we are here to be that integrated, sustainable, and statewide delivery system with a centralized hub to coordinate fall prevention activities and the evidence-based programs via the North Carolina Center for Health and Wellness and our Healthy Aging Initiative. Thank you for listening today, and if you would like to talk more and connect with me about how to build fall prevention programs and strategies into your community, please feel free to contact me at aojones@umca.edu or call me at 828-250-3991. Thanks again for joining me, and please have a beautiful falls-free day.